Welcome back to the show Talk with Your Doc. With me is Dr. Kenneth Gehman, a general thoracic surgeon at Thunder Bay Regional Health Science Center. Dr. Gehman, we were talking about various risk factors for the lung cancer, and we talked about smoking, we talked about radon, we talked about asbestos, and possibly environmental pollution can cause risk factors. So, how can we prevent the lung cancer?
Oh, well, the most important thing is the smoking issue.
Yes.
That's the most preventable thing. If people, avoid cigarettes, avoid secondhand exposure to cigarettes, then it greatly decreases someone's risk in their lifetime of getting a lung cancer. The radon gas issue, you certainly could get your own household checked for that. But other than that, there aren't, we cannot avoid the air pollution issues.
Right. Yeah.
But
so
the clear thing is
with
avoid
regards
the
to smoking, there are new types of cigars. They say electric cigar, and there are different types of options or alternatives. Do they reduce the risk of lung cancer?
There are pros and cons to this. So, some people see e-cigarettes as, being a way of being able to decrease or increase their ability to quit smoking.
Yes.
I just see it as an aid. But on the other hand, it's also, you see young people using e-cigarettes.
Yes.
And then that subsequently may lead them into smoking tobacco,
yes.
which is a bad thing.
Yeah.
I think the best thing is to avoid them.
Yeah. No smoke is a good smoke.
Yes, absolutely.
Is a diet, if somebody improves upon the diet, like fresh fruits and vegetables, good exercise, that can...
Well, these are all healthy measures.
It's
important to live a healthy lifestyle. But really the most important thing is avoid the cigarettes.
Avoid the smoke. First-hand or second-hand smoke to be avoided.
Yes, absolutely.
Now, how can we detect the cancer in the lung at an earlier stage? So is there any test, is there any way, protocol, screening process by which we can detect the lung cancer early stage?
Fortunately, with other cancers, such as breast cancer or colon cancer, there are organized screening programs with breast, with mammography, and colon cancer with stool testing and colonoscopy. Unfortunately, with lung cancer, there are no organized programs in Ontario. They are coming. Okay. It is coming. There is strong evidence that in high-risk populations, so if you're over 55 and you've smoked for 30 pack years and haven't quit in the last 15 years, there is strong evidence that if you had what we call a low-dose CAT scan of the chest for 3 years in sequence, that we actually can decrease the mortality from lung cancer by as much as 20% by picking up cancers early.
So the patients who are risk for the lung cancer, patients who are smoking more than 30 pack years, those patients can get this low-dose CT scan test done?
The provincial government currently doesn't support that.
Okay.
But the Cancer Care Ontario has agreed that the evidence is there from a number of big international studies to show that yes, doing low-dose CT scans in high-risk population decreases chances of dying from lung cancer. And they are initiating a pilot in various centers throughout the province. Strictly speaking, as a physician, the provincial government would not, I think, support you in ordering a regular low-dose CT scan on all your smokers.
Yes.
But I would say this is coming.
So it's a regular CT scan, but the amount of radiation dose is very, very low, so that it does not damage.
So the dose of radiation is actually a third of what you would get in a regular CAT scan.
Okay.
And the other issue is there's no need for any intravenous injection.
Right.
And it takes a very short
And it's
period
much
of time.
better than the X-ray probably of the chest. It is
Yeah,
more
is that-
sensitive and specific than the X-ray.
Yeah, the studies that have been done have actually compared, annual chest X-ray versus CT scan, and annual chest X-rays do not save lives.
Right.
Annual low-dose CT scan in high-risk population
Can save life. Other than this CT scan, what are the signs and symptoms? If somebody has a lung cancer, how he presents?
The classic sort of presentations are cough, shortness of breath, coughing up blood, chest pain, unexplained weight loss, new onset hoarseness.
That is in the late stage. In the early stage, probably lung cancer is
early
asymptomatic.
stage. Yeah, you can hide, a 10 centimeter tumor in your chest and have no symptoms.
No symptoms, right? So there is a big tumor in your lung, but you have no symptoms.
No symptoms at all. Okay.
So that's possible. So it's better not to wait for the symptom, get the investigation done.
Absolutely.
So what sort of investigations are done to diagnose the lung cancer? What do you use in your practice? I see a lot of biopsies from you.
So I to start with, I don't see anybody who's really not had a CAT scan. That's our fundamental workhorse investigation. So patients get referred to me with a CAT scan. Gives me the information as to how big someone's lung lesion is,
Yes.
whether there are any other lung lesions, whether there's any enlargement of the lymph nodes in the central part of the chest, and also gives us some information about the liver and see if there's any spread or any fluid around the lung. So that's our workhorse investigation.
And you do mediastinoscopic biopsies and lung biopsies. So lung biopsies, what are the risk factors involved?
If we have a new lung nodule which is suspicious, the procedure of choice is usually what we call a core biopsy or a needle biopsy. That's done by our radiologists at the hospital as an outpatient procedure. And in terms of accuracy, it will make the diagnosis of a lung cancer when you have that about 70 to 80% of the time. 20 to 30% of the time we get a negative result. Negative result does not rule out lung cancer.
Yes.
It may simply mean that we did not get you,
lesion.
the pathologist, a good sample.
Good sample, right.
So that's our workhorse investigation. It has some small risks, maybe coughing up a little bit of blood, which is self-limited. Chance of getting a collapsed lung requiring placement of a chest tube, that happens about 7% of the time.
So low-dose CT scan is a screening process, followed by if the patient has signs and symptoms, you'll do CT scan, required bronchoscopy and biopsy. And once the biopsy comes, then you further treat it, right?
Yes, that's correct. So the first thing usually is to make a diagnosis. And to determine that this is lung cancer and what subtype of lung cancer we may have. And then next we look at doing what are called staging investigations to see if there is spread of the disease.
Thank you, Dr. Gehman. We'll take a short break and we'll come back shortly. Thank you.